Focus. Ideate. Innovate. Enable.
The number don't do us proud. Be it doctor-patient ratio or patient-bed ratio or the alarming rise of lifestyle diseases and death. So how do we make these numbers better? The simple answer is we need a perfect health system to change our healthcare landscape. That's a talking point. In search of a perfect health system. Okay, Dr. Brittle, if I may begin by asking you. You have visited 60 countries to write this book, In Search of the Perfect Health System. So which country's healthcare model you are very impressed with, or that feels suitably impressed?
Well, thank you for inviting me on the programme. Over the last 6 years, I've worked in 60 countries on 200 occasions.
Okay.
And I've circumnavigated the planet 70 times over.
Oh.
The conclusion, I'm sorry to say, is that no country in the world has the perfect health system, but many countries have excellent examples of great healthcare. And thinking specifically about the context in India, I think some of the primary care developments in Israel, some of the community service developments in Brazil, and also some of the health insurance, public and private sector partnerships in Singapore could all work very well in this country.
Okay, as far as healthcare is concerned, there are two Indias. At one end of the spectrum, you have those world-class facilities which can be affordable by the rich. At the other end of the spectrum, the poor don't even have the primary healthcare facilities. So how do you bridge these two Indias?
I've been studying, the various models in the different states. I can quote here the Andhra Pradesh, who launched the Arogya Shri scheme way back about 7 years back. Under this scheme, they have covered 70% population of their state, and the government is pitching in 2 lakhs rupees per family. And actually they get virtually covered for all the kind of diseases. Even the Mark Bittner, in his own book, has mentioned that 40% of the population of India is covered today under some or other scheme. In fact, I can quote also the World Bank report, which says that by March 2015, which is already over, 50% population is getting covered under some other scheme. Now, following up the Andhra Pradesh, Tamil Nadu has a similar scheme, Karnataka has a similar scheme, now Maharashtra has come out with the Rajiv Gandhi Arogya Shri scheme. So, what I am trying to say that by this way, universal health coverage is making little progress at least in 4 states. Over and above, if I count the RSBY, which is very large coverage, though very marginal, because 30,000 per year per family is a very small sum, but at least some coverage is there. So, what I am trying to say is that in our country, we have already made substantial progress, but this has to be replicated now.
The healthcare is not accessible, it is not available, not affordable. You're talking about the insurance part. I'm saying that the demand-supply mismatch of doctors to patient, hospital beds to patient, and nurses. So, if you take a single component of, let's say, doctors and hospitals, how do we address that issue?
I think one of we were speaking about universal healthcare earlier. So, if I had to sort of talk about the main levers of the health system, because I think we're really talking about in search of the perfect system. Some of the key ones that we look at is, we start off with financing. Obviously, right? We say as a public system or as any system has to first of all invest in the system for it to work for both the the rich and the poor. The second and a very critical part that I think we're working on is the human resource part. And as I am sure Mr. Daljit here and everybody else will agree, in operations, more than 50% of your P&L for any hospital, public or private, is really spent on salaries. It's on people. Okay. And that is the biggest part that, we unfortunately in this system still have a lot of work to do. We have a huge shortage when it comes to doctors, when it comes to nurses, when it comes to allied health professionals, which is
so I thought if we can take one comment of the doctor part, let's
talk about doctors.
That issue? Well, I was told there are 56,000 doctors coming out every year.
Yeah. But, if you look at the ratio where we are.
Postgraduate, there's only 26,000 seats available.
Right. So and then we also have a huge out-migration issue, which I'm sure you know of. So there is a lot of, there are a lot of doctors that we lose on an everyday, on an every year basis rather, to, out of the country. We also lose when the public system and the private together, between the almost 400 some colleges, there are a bunch of doctors coming out, but a lot of them either end up working in the private sector or leave the country. A lot of it also has to be done in terms of remuneration and in terms of making sure that there is a career pathway, career progression, some sort of true development for leadership that happens for the doctors, and in terms of planning, which doesn't happen here, which I think is one big retention factor that we are working on in terms of policies. The second part I think that's also very critical, sort of to note, is that if I'm not given my true value in the system, if I'm I'm not skilled enough, if I don't know exactly what I'm supposed to do, just giving me a degree or, giving me a piece of paper that says I'm a doctor really is not going to help at all. So I end up a lot of times, as maybe a trained doctor from a private facility. Typically the public, we have a lot of very, very good educational systems in place. But in the private sector, what also happens when people are coming out, we don't have regulation and standards in place to ensure that there's a uniform quality of all of these healthcare professionals, doctors and others coming out. Okay. This causes a huge deal of problem as well. So those are two big issues that I think we've got to fix, so that the quality part can be addressed by the doctors. Finally, redistribution. We have doctors all sort of in the urban areas. Where are the doctors in the villages? Our villages don't have doctors. We continue to use, sort of all kinds of providers, alternative providers.
We'll come to that. Basically, there's no holistic approach to the healthcare sector because, to my mind, when I look at other countries like USA, Brazil, the healthcare spend is very high there. That's nearly 17% of GDP. In India, it is around 4%, both private sector and public sector put together. Is it because it is not an election? Elections are not won or lost on healthcare issues in this country?
Well, frankly, Ravi,
that is getting a very low priority in terms of...
I don't think healthcare has been a priority sector for our country. Pardon me for being a bit blunt on this. It isn't a number one item. It is spoken about occasionally, but there is absolutely no follow-up. There's no integrated planning. We don't necessarily have the best people at the think tank level guiding the development of the healthcare sector in our country. There's a lot of shortfall, and we need to look at what the country's priority agenda is, and unless healthcare finds a place there, it's not going to move forward. In fact, what we are seeing is that over the last decade that we've been seeing some research reports being published, our percentage GDP spend on healthcare has actually dropped by about 0.2 to 0.3 percentage points over the last decade, which is not a great comment. The last government had recommended that the public spending will actually go up from 1 percentage point to 2 to 3 percentage points of the GDP. Yeah. I think that also is not happening. In fact, we've seen a budget reduction take place in this year's budget. So there is a fundamental issue. This needs to take center stage. It needs to have an integrated planning system. So the points that Dr. Gyani mentioned very properly, that we should have proper distribution of hospitals, of medical colleges in a manner that
incentivize the doctors.
Absolutely.
Ravi, one of the things, I know you were seeking a solution for the previous topic around education. And I'll also address this topic around why it's not an election issue and why it can become one. I think if you look at what happened on engineering schools, for example, and the demand for engineers in India, right? There was a today we are in a situation where engineers are a glut. The number of engineers that come out of Indian engineering colleges are more than what the industry needs. Go back 20 years, early 90s, it was just the opposite of that, right? There were more engineers very few engineers seeking a lot of jobs. So I think creating an environment for investment in healthcare, I think that is what the enabling infrastructure that the government can do. Look at this from a perspective of FDI. I think if
why FDI not happening in this sector?
I think FDI in the traditional sense of the word that we are seeing, which is a entity coming in and setting up 100% owned entity, so on and so forth, is probably not happening to the extent that we would want. But private equity and venture capital funds are galore in India as far as healthcare is concerned. And if you see, there's a lot of attraction of that investment that is coming into India.
Do you think the government should not be in the business of hospitals and they should be only providing insurance cover and they should get out of the hospital business completely? And here a public-private partnership could work better.
I think in my opinion it will be very difficult for our government to come out completely. I'll tell you the reason. Today we have got around 1.5 lakhs sub-centers, 25,000 primary health centers, 5,000 community health centers and another 15-20,000 government hospitals in the entire country. Now this whole infrastructure, if you ask me, even if it is not taking care of the urban population, it is definitely taking care of the rural population where private sector has not gone. So I think for next 5 years I can say, for rural sector, this is the only communication or all the infrastructure available. They come up to referral up to district hospital and from there go to the medical college hospital. So this, at the moment, you cannot disband, number one. Number two, partly PPP is already happening. For example, in CGHS scheme, ECHS scheme, state government scheme, government is buying healthcare for its own citizen from the private sector. So this is also a PPP model. But government, I think to begin with, but otherwise if you ask me, they are not investing in a new hospital. Except few aims here and there, government willy-nilly is quietly sitting because private sector is coming up.
Can the role of technology really help build the demand-supply mismatch in terms of hospital beds, in terms of doctors, in terms of nurses? So I'm saying, can technology play a big role here in building?
Technology, Ravi, can play a massive role here. But I think we have to understand that technology will play a role across the entire health continuum, right? I think there is a feeling that telemedicine is the Rambaan Ilaj from a technology point of view. I don't think that's the only solution, right? The way we look at it at Philips, and I think I'm hearing similar kind of health continuum kind of discussion here, is that we need to focus on at the front end on the primary care and see what technology is required for that ASHA worker to be able to collect information which is important on vitals and send it to a doctor who can have a look at it. Just to give you an example, we've developed this locally here in Bangalore at an R&D center where we have a palm top ECG machine, which is a 12-lead ECG machine, which can be actually used by a simple nurse to get the ECG. It has got what is called a GSM card, which you can then send the ECG to a cardiologist anywhere in the country. That is simple technology which can be used in a country like India, right? If you go to diagnostics, I think I've talked about that, but in terms of recovery, in terms of tele-ICU, we work very closely with Fortis and customers other than Fortis. In terms of our tele-ICU solution, India has 180,000 ICU beds, but we have only 5,000 intensivists across the country. Most of those ICU beds are actually managed by anesthetists. Nothing wrong with that, but it's not a qualified intensivist who's managing it. We've developed a solution locally here in India where we are able to now look at a remote ICU bed as if that patient is right here in Delhi or in Chennai or in Bangalore, where a command center is managed by qualified intensivists. This is a solution which was actually developed globally, but we found that the cost of that technology was way too expensive for India, so we actually brought it down to be in a position to be affordable for a market like India. Three things we looked at. One, of course, to ensure that patient care is taken off. Think about a patient somewhere in Warangal who needs an ICU bed, right? But he can't because the hospital over there says, sorry, I can't take care of you. You have to go to Hyderabad for it. They have to travel that 200 kilometers with a family member, maybe two family members. A critical patient is traveling. Typically, mode of transport would be road or rail, which is dangerous for that patient. What if you were to be able to keep that patient in Warangal? So that's a patient care dimension, and monitor that patient.
Is it telemedicine?
Through a tele-ICU solution.
Tele-ICU, okay. It is talking about technology.
Yeah.
What has your experience been?
Well, in the book, towards the end of the book, I talk about promising near-term trends. First of all, let me completely agree with what's just been said by Philips. One of the great things about the Singaporean health system is their whole health strategy now emanates from the home. So it starts with healthcare at home, not hospitals. And because they're such a tech-savvy state, they are basically integrating hospitals with nursing homes, with residential homes, but also providing and streaming many more services into the home for those with non-communicable or chronic diseases. So this is a big, big global trend. We also know, of course, that wearables have now been valued at over $700 billion in terms of being a global industry. We're also seeing the introduction of retail pharmacies in the United States, providing primary care. So what we're starting to see is other sectors and industries moving into healthcare. The telecommunications industry, the medical devices industry, retail industry, and they're starting to change our appreciation of what healthcare is. Clever hospital chains such as Apollo or Fortis that you have in India will soon have to make alliances with many other people to provide healthcare. My own belief, and I say it in the book, India does have some great strengths. Your jugaad innovation, your ability to solve problems quickly is, I think, recognized throughout the world. Your ability to standardize clinical processes is admired around the world. The application of ICT to those processes gives you more flexibility with your workforce. So while we spent a lot of time today talking about the downside of Indian healthcare, and yes, they are significant, the upside, I think, is also very, very promising indeed.
Basic question we're coming back to is, whatever Jugaad is talking about, whatever role of technology, the cost of healthcare has not come down. Out-of-pocket expenses is very high in this country. I think nearly 43 million families are pushed below the poverty line. So how do we change this?
Well, Ravi, I think one of the paradigms that we should look at is a point that was raised earlier on in the discussion by Dr. Gyani. He took the example of Andhra Pradesh. There's a 2 lakh insurance. Now today, a person can go into the marketplace, get an insurance cover he pay 5,000 rupees and get an insurance cover of 3 lakhs for his or her family of 4 people. So you can actually have 30 crore families of the entire Indian population under an insurance cover of about 3 lakhs per family for as much as 150,000 crore rupees, which is close to about 35-40% of the entire healthcare spend in our country. So it's not such a big deal, frankly. But where we need to focus and understand is that, let's say, organizations like the government perhaps need to focus more around regulation and as a buyer of services rather than as a delivery. That it will deliver services in the critical domains is a given.
So universal healthcare is an answer for all those things.
Absolutely right. And there is a
model
which
shying away
exists.
from that.
There is a model that exists. And we need to think about this very, very seriously. That's how rapid scale-up is actually taking place in our country.
If the government came to each one of you and asked you advice, what are 2 or 3 you tell the government to do that could change the healthcare landscape of the country? Starting with Dr.
Two things. The first thing I would say is move within the next 5 years to double your expenditure on healthcare from 1.2% to 2.5%. And secondly, have a 10 to 15 year public-private partnership view on how you're going to build your health system and therefore your nation.
Dr. Gyani?
Okay. I think I agree with his first point that let the government spend 2.5%. Second, let them give incentive to the private sector to set up the hospitals in tier 2 and tier 3 city. Let us say 5 years tax holidays. You will certainly transform the healthcare scenario of the country. Number 3, education reforms have to be brought up as early as possible, setting up the colleges, and more importantly, let me tell you here, the PG seats. Unless you increase the PG seats, you will not have specialists. Today we have only 12,000 radiologists in the country. How can you manage? And finally, also I want to...
4 points, you're only answering.
Three. Okay, last point is that, everybody has been talking, that replicate Arogyashri kind of a scheme. One small point I'll tell you, microfinancing, if you collect 10 rupees from the mobile bill per month, you will get 120 rupees. And if I take the RSBY model, you will be able to provide hell of a lot of coverage to the family. This is a very innovative idea. Just put 10 rupees per month in the bill of the mobile and let it come. And I think these...
More cess, more tax, I don't think it will be welcome by anybody.
No, but this insurance, what Daljit was talking, it is something similar to that. 10 rupees from the mobile, which you will not mind. It will just go.
Kavita, what's your 2 or 3?
I'm going to stick to 2. I think I'll sort of go to, going back to all of our previous discussions. I think the government's primary role, and I think hopefully I'll have a better chance of doing that now, but regulation and setting standards. I think the standard setter, holding people, making sure that the quality is what it needs to be, and holding the line on everyone in terms of provision of care is really the government's role. And I think that's one of the key areas that they can, the government can focus on and make massive change. And the second, I'd go back to partnerships, collaborative work, including in finding innovative solutions for, even encouraging the private sector to get into investments. And, because today the idea is that maybe primary care is not a very sustainable, investment. I think that it's a myth. Nobody's even tested it out enough to say that that's not true. So I think we must, both the government and the private sector should work closely to look at really focusing on primary care, including in terms of investment. So I would say those would be my 2 points.
Mr. Singh? So the 2 additional points that I'd like to mention. First is, I think nationally we need to do an integrated planning for healthcare. We need to have people around the table who are considered leaders in this domain, be it from the private sector, public sector, academia, get them all around the table. I don't think that level of dialogue is actually taking place. For some reason, the government, does not think of the private sector as a resource that belongs to this country. I think we need to do that. So we need to have a think tank of all able people and contribute to the development of a health policy and a framework that makes sense for our country.
That's very interesting. Sami, final word?
I would say the first one would be a combination of insurance, primary care and education as the three most important things that the government should do and focus their attention on. Right? I think leaving it to private sector to do primary care and the education portion has obviously not, so I think that would be the first thing in terms of government focusing on primary care, insurance and education, medical education. And I think the second would be, I think private sector is not going to shy away from investments, but I think they need an environment where more FDI can come in. I'll give you an example. India, for medical equipment, is the only country amongst all emerging markets and developed markets where there's a customs duty. There is no other country in the world which has even anything close to even 1 or 2%. We have 12%. Now, there are only 1,300 MRIs in a country of 1.2 billion people, right? Philips will be more than willing to invest in India more and more, but it creates a certain gap in our profitability, right? 12% incremental, and so you have to have an environment which is conducive to investing more. And believe me, it's an industry which is growing very fast. It's growing at twice the GDP, and clearly there's a huge opportunity out there. So private sector will be more than willing to invest in this.
Okay, a lot of interesting ideas and suggestions coming. I hope the government is listening. Thanks for being on the show.
Thank you.
Yeah, thank you.
Focus. Ideate. Innovate. Enable.